My daughter's almost 10. Her whole life I've been having the plastic surgery, so she doesn't even know what I look like as a natural person. I've always had a discussion with my daughter, and I might not make it out of surgery. She cries and, asks why I'm having this surgery. She says, "Mommy, you look like a Barbie doll. Why do you want to do something?" But I can't help it. I really can't help it. When my daughter sees pictures of me before I had any surgery, she doesn't recognize that that's me. We don't even look alike. I miss the resemblance that I had with my father. That's the worst.
The signs and symptoms of a plastic surgery addiction are similar to those of BDD. Some of them include constantly seeking cosmetic procedures with little satisfaction, unrealistic expectations about surgery and thinking it'll lead to better relationships or higher paying jobs, engaging in behaviors aimed to fixing or hiding the perceived flaw that are difficult to resist or control, like frequently checking a mirror or grooming oneself, attempting to hide flaws with styling, makeup, or clothes, constantly comparing appearance with others, frequently seeking reassurance about appearance from others, quickly returning attention to same or other flaws after surgery, when you are satisfied with a procedure, you suddenly realize that you have another flaw that's unacceptable and you desire additional surgeries. Often going to extreme lengths for cosmetic surgeries to obtain perfection. The willingness to spend large sums of money on cosmetic procedures even when it's not financially feasible. The desire for protection obstructs your relationships, your work, and other areas of daily life. And being extremely preoccupied with perceived flaws in appearance that others may not even notice or be able to see. As I mentioned, many people who have a plastic surgery addiction will undergo more operations to correct either previous ones or to fix new perceived flaws. Multiple operations, even when performed correctly, will usually result in an overall unnatural and bizarre appearance, which will exacerbate the addiction further. Multiple operations could also have unintended consequences. Some of the other side effects of a plastic surgery addiction include blood clots, scarring, bruises, swelling, collapsed muscles, excessive bleeding, nerve damage, tissue death, infections including pneumonia, delayed healing, and of course there are anesthesia risks including shock, respiratory failure, allergic reactions, and cardiac arrest.
Attachment styles. So, what type of attachment style does an individual who has plastic surgery addiction have? Preoccupied anxious is the attachment style that individual would have. These individuals are usually insecure in intimate relationships, constantly worried about rejection and abandonment. Preoccupied with relationship hyperactivates attachment needs and behavior. They are usually needy, require ongoing reassurance, want to merge with partner, which scares partner away. They fit under this attachment style as they are always in a negative state in their appearance and always want to change themselves to feel accepted. Can this be addiction? So number 1, the step is salience. This is the single most important thing in that person's life and that they will do it to neglect of other things in their life. Individuals who are plastic surgery addicts, they have invested all this money into making their body the way that they want. They will keep indulging in it till they perfect it. And initially, it begins with a positive experience when someone who lives with debilitating insecurity feels better about their appearance after their first operation. They may decide to have another one to correct another flaw. As soon as plastic surgery becomes the solution to negative self-perception, some people will sign up for as many procedures as they can afford. Step 2 is mood modification, whereby addiction is used as a consistent method of shifting your mood state, whether to get high or to tranquilize your mood. Plastic surgery addicts may find it satisfying their moods, which then they start to begin to structure their life around upcoming operations and begin to rely on plastic surgery as a source of their self-esteem. Step 3 is withdrawal symptoms, including extreme moodiness, nausea, headaches, sweats, and so on. Studies show for individuals who are addicts of plastic surgery, their withdrawal symptoms are related to those who have obsessive-compulsive disorder. The symptoms are drowsiness, headache, flu-like symptoms, hyperarousal, imbalance, insomnia, irritability, or nausea. Step 4 is increased tolerance, where people need more and more over time to reach the same effects. This could involve betting higher sums of money or taking more of a drug. Individuals with plastic surgery addictions or body dysmorphia may spend hours every day thinking about their appearance or looking at themselves in the mirror, trying to figure out how much better they can make themselves look. Step 5 is conflict. The addiction becomes so all-engrossing that it harms everything else a person does, including work, school, and relationships. Body dysmorphia disorder has the power to adversely affect a person's social life, since people with the disorder often feel self-conscious and constantly compare themselves to others. This is their only way to build self-esteem. They become addicted even when their surgeons deny that of them doing any more work. They go to someone who is less qualified just to get that satisfaction of getting something done. And the final step is relapse, which is as soon as a person goes back to the activity they are addicted to, they quickly fall back into the cycle. Plastic surgery addicts do not adequately fix someone's appearance. They feel even worse about themselves and seek out more procedures. All that while leaving the body dysmorphic disorder active and untreated.
When does a person's love for plastic surgery cross that line from hobby into a full-blown addiction? Lacey's been put under anesthesia 47 times, has undergone 12 breast augmentations. She insists her love of plastic surgery, it's not an addiction. On the other hand, Christina feels her love of plastic surgery is an addiction, but still has no intention of stopping in her quest to look like a caricature of herself.
I was always a tomboy because I was only a girl. My mum used to try and dress me up, turn me into a girl, and it never happened. Hair tied back and just having fun. I was 15 when I went on my holiday to Spain. I was walking down the street and I saw an artist doing caricature drawings. I knew right away I wanted to have a drawing done of me, so I got in line and queued up to have the drawing done. When I saw the picture, I loved it and I knew I wanted to look like that someday. After I'd had the picture done, I started experimenting with makeup. I started using the tanning salons and having hair extensions. When I was 17 years old, I had my first boob job. After the boob job, I went on to have Botox, collagen, another 4 breast enlargements, and the semi-permanent makeup. So far, I've spent about $200,000. At the minute, I'm looking for a new surgeon to carry out another boob job. I want to double the size of what they are now, which would take them to 2,000 cc.
Christina, I'll be frank with you, I've never heard of this before. I'm a little bit speechless. I'm speechless.
When you have a caricature drawing done, they're almost trying to make you look like a cartoon character.
I wanted to be the exaggeration.
But you see where you're heading. You've already had multiple breast surgeries. I don't think you're ever going to be happy with yourself, no matter how many surgeries we do.
No, it's a hobby to me and it's something to do.
What you are doing, it's not a hobby, it's an addiction, and it's an addiction that's affecting your health. That's where the problem is. If it were just a hobby and you were doing things that were reversible, that weren't harming your health, we would say go for it. And if you can afford $200,000, spend it. But when you cross that threshold, and this is Dr. Orden, he knows, and he puts in breast implants for a living.
That's right. And each time you do breast surgery, you increase the chances of developing complications. So how about we stop here?
Yeah.
And you find another hobby, okay?
I've never, over these 15 years, had a point where I've thought, this is terrible, I really don't want, such a bad experience, I don't want to do it again.
It's not that you hurt right now, it's that we've seen this. And if you continue, you're gonna be like our patients that we see who always say to us, if only I could have done something differently to have prevented this from happening.
We live in a world in which, as a global population, our body image issues are only increasing. As plastic surgery becomes more commonplace and more affordable, The same goes for treatment and therapeutic modalities. Generally, treatment consists of a combination of cognitive behavioral therapy and pharmaceutical options. Research on effective treatments for individuals with body dysmorphic disorder is still greatly needed, however. Cognitive behavioral therapy, or as we know, CBT, has proven to remain very effective in treating plastic surgery addiction and body dysmorphic disorder. CBT places an emphasis on supporting the individual to identify their negative thoughts, emotional reactions, and behaviors that have persisted over time. CBT also allows the individual to learn methods to challenge these automatic negative thoughts they have about their body image and to adapt more flexible methods of thinking. CBT also focuses on methods to handle rituals and urges that the individual might have, such as mirror checking or reassurance seeking. CBT also teaches the individual other behaviors to improve their mental health, such as addressing social avoidance. The individual and their therapist can also talk about goals for therapy and develop a more personalized treatment plan to learn and strengthen their coping skills that they might have. Involving family members in treatment may be particularly important, especially for teenagers and younger individuals who are affected by this disorder. Medications and pharmaceutical alternatives. So no medications have really specifically been approved by the FDA for body dysmorphic disorder or plastic surgery addiction. Medications are generally used to treat other coexisting conditions. So this could be, depression and obsessive compulsive behavior that the individual might have. So generally, selective serotonin reuptake inhibitors, known as SSRIs, are prescribed, and this is because body dysmorphic disorder is thought to be caused in part by problems related to the brain chemical serotonin. So SSRIs appear to be more effective for body dysmorphic disorder than any other antidepressants, and these really support the control of negative thoughts, repetitive behaviors that the individual might have. In some situations, other medications in addition to the SSRI may also be prescribed. In very severe situations, hospitalization may also be required. Some symptoms may become very severe to a point of psychiatric hospitalization. This is generally recommended when the individual isn't able to keep up with their day-to-day responsibilities or when they're in immediate danger of harming themselves. So who is primarily affected? So body dysmorphic disorder, as we know, is the underlying psychological concern behind plastic surgery addiction, can affect men and women of all ages. In recent years, it has been affecting women and men pretty equally, and it has been more common at a younger age. A study in Belgium researched patients seeking rhinoplasty, which is a nose job, and of the 266 participants, 20% had already undergone a previous rhinoplasty surgery. So this means that individuals that are seeking cosmetic procedures most likely have already undergone some form of previous surgery. In addition to this, research has also found that 43% of the people in this particular study were choosing plastic surgery for purely aesthetic reasoning, and they were already suffering from moderate to severe symptoms of BDD. So this means that those who are choosing plastic surgery for aesthetic reasons already suffer from moderate to severe symptoms of BDD, and this is a really big concern. The researchers also found that symptoms of BDD were not mitigated, but actually exacerbated after the surgery was completed. So the rate of BDD in the general population is thought to be around 2.4% in the United States. I wasn't able to find any statistics for Canada,